We can't allow Kennedy or Trump or anyone else to bring unimaginable suffering to the American people. So if the president-elect doesn't reconsider the nomination, the Senate has a duty to our whole country, but especially to our children, to vote no. With the nation facing a possible bird flu outbreak, are they really prepared to roll the dice on the lives of their constituents by placing someone in charge of public health who has made it clear that he will prevent or she will prevent the approval of life-saving vaccines?
That was just a sample of Michael Bloomberg's plea to United States senators today, directly asking them to reject an anti-vaxxer as the country's Health and Human Services, HHS secretary. Bloomberg warned that the next pandemic isn't a question of if, but a question of when, and that putting RFK Jr. in charge of vaccine policy would be, quote, medical malpractice on a mass scale, end quote. It's not just that Kennedy has promoted anti-vaccine conspiracies for years, or that he heads a group that specifically aims to undermine children's vaccines and the confidence people have in them, or that he has no medical or public health degrees. But we actually know for a fact what vaccines do, thanks to studies and science and pediatricians. In our own experience, the COVID-19 vaccine saved nearly 20 million lives globally during just the first year of vaccinations. That's according to the National Institutes of Health, which, as part of HHS, would also fall under Kennedy's control. And yet Kennedy outrageously and falsely called it the deadliest vaccine ever made. Here's more from Michael Bloomberg today.
After all, Kennedy has attacked what may be President Trump's biggest first-term accomplishment, something called Operation Warp Speed. It saved millions of lives, allowed the economy to reopen, and helped Americans get back to their normal routines. And just imagine if RFK Jr. had been in office during Trump's first term, how many fewer people would have gotten the shot? How many more people would have died?
Joining our conversation, co-director of the Center for Vaccine Development at Texas Children's Hospital and dean of the National School of Tropical Medicine at Baylor College of Medicine, Dr. Peter Hotez is here. Tim Miller is back with us as well. Dr. Hotez, let me just add a few more pieces of reporting into the conversation. The Associated Press last year reported that RFK Jr. has made his opposition to vaccines clear. Quote, in July, Kennedy said in a podcast interview that, quote, there's no vaccine that is safe and effective. RFK told Fox News that he still believes in the long ago debunked idea that vaccines can cause autism. In a 2021 podcast, he urged people to resist CDC guidelines on when kids should be vaccinated. Quote, I see somebody on a hiking trail carrying a little baby, and I say to him, better not get them vaccinated, end quote, Kennedy said. Let me just deal in facts and science, since we have you, and it's such a treat to get to talk to you. On the link between vaccines and autism, I know this is an area of expertise for you. What are the facts?
Yeah, the facts are, Nicole, vaccines do not cause autism. In fact, I wrote a book about my daughter because I'm a pediatrician, a vaccine scientist. I develop vaccines. We developed a COVID vaccine reaching 100 million people in India and Indonesia in our laboratories. And I also am the parent of an adult daughter with autism. And I wrote a book called Vaccines Did Not Cause Rachel's Autism to put that away. And the massive scientific evidence showing there's no link, and they allege different vaccines. It started with the MMR vaccine, measles, mumps, rubella. Then Robert F. Kennedy Jr. came out in 2005 in Rolling Stone magazine, said it was thimerosal. It's all nonsense. And then also what we know about the genetics of autism. And now we have a number of autism genes that have been identified. So we have a complete story about it. So that is completely erroneous. There is no link between vaccines and autism, and it's awful that he keeps on pushing it. I mean, here's the reason why we need to care about this stuff, Nicole, is that we have some big picture stuff coming down the pike starting on January 21st. Mr. Bloomberg mentioned H5N1. That I'm really worried about. It's all over wild birds on the western part of the United States and going up in the north. It's getting into the poultry. We're seeing sporadic human cases, no human-to-human transmission yet, but that could happen. It's in the cattle, it's in the milk, and that's just the beginning. We have another major coronavirus likely brewing in Asia. We've had SARS in 2002, SARS-2, COVID-19 in 2019, and we know these viruses are jumping from bats to people thousands of times a year, but there's still more. We know that we have a big problem with mosquito-transmitted viruses all along the Gulf Coast, where I am here in Texas. So we're expecting dengue and possibly Zika virus coming back, or a Puche virus, maybe even yellow fever. And there's more. Then we have all this sharp rise in vaccine preventable diseases going up because of, in part, the anti-vaccine activism that's so prominent right now. We have a 5-fold rise in pertussis cases, whooping cough over the last year, 15 measles outbreaks this year. We've got polio that's been in the wastewater in New York State. All that's going to come crashing down on January 21st on the Trump administration. We need a really, really good team to be able to handle this.
Tim Miller, all it takes, I mean, RFK said, I'm not going to take away anyone's vaccines. That may or may not be true. But all it takes is to say what he said on a hiking trail to a parent carrying a little baby, quote, I say to him, better not get them vaccinated. And you've got people very, very sick or dying of all the diseases Dr. Hotez just listed. It's not about what you take away or don't supply. It's about what the country does. And I think we know already what the country will do. The pipeline of scientific disinformation, the attacks on Dr. Hotez specifically, and doctors and scientists generally, it's a play the right has been running for years. Your thoughts as we head into the final period where you might have science-based government health agencies?
Yeah, and there's a lot concerning there. I would just start, since Dr. Hotez is here for his expertise on the science, I can bring my insight into the human condition. That is an insane person that stops on a hiking trail and says to a stranger that they should not vaccinate their child. Could you imagine? If I was in that situation, walking on a hiking trail with my child, I would be running away as quickly as possible. Like, please do not talk to me, sir. And so, like, the idea that having a deranged person in charge of HHS leads to a lot of potential risks and problems, and just as far as management, in addition to what we're talking about here specifically with regards to vaccines. So I think that's number one. Number two is just the messaging element of all of this, right? I think that that you can play a nudging role within government that is different from laws and rules, right? Like having government officials raising questions about this, changes human behavior, and I think that and I think that's very concerning, particularly when it comes to vaccines. And the last thing I'll just say about this is having Michael Bloomberg as an advocate. Now, he might be a Democrat, but in a lot of ways, him and RFK have some weird overlap and that Make America Healthy Again space. Like Bloomberg has credibility here. There are legit ways the government could come in, and you could disagree or agree on that's government's role as far as big gulps and encouraging health, and there are ways to do that. And so for Bloomberg to be the voice there, I think is very telling, because you could imagine a different world where him and RFK would have areas of agreement, and instead he's sounding the alarm.
All right.